The central question explores the motivations behind the widespread appeal of cannabis. The investigation aims to determine if cannabis use is solely for its psychoactive effects. Deeper reasons for cannabis use may be linked to its effects on the mind and body. The study explores the potential therapeutic benefits of cannabis beyond recreational use. Understanding the motivations behind cannabis use requires an examination of both psychological and physiological factors. This presentation will cover how marijuana affects brain chemistry. Marijuana use is driven by various factors, including recreational, medicinal, and psychological reasons. Understanding the benefits and risks of marijuana is crucial for informed decision-making. Marijuana's psychoactive effects stem from its interaction with the brain's endocannabinoid system. Potential benefits of marijuana include pain relief, anxiety reduction, and appetite stimulation. Risks associated with marijuana use include addiction, impaired cognitive function, and respiratory issues. The topic of marijuana is subject to ongoing debate, with diverse perspectives held by individuals and communities. This exploration aims to objectively present the various viewpoints surrounding marijuana. Understanding the multifaceted nature of the marijuana debate requires considering a range of arguments and evidence. The objective presentation of diverse perspectives is crucial for informed decision-making regarding marijuana policies. THC, the primary psychoactive compound in marijuana, is introduced into the body through consumption. Upon entering the body, THC is rapidly absorbed into the bloodstream. The bloodstream transports THC throughout the body, including the brain. THC crosses the blood-brain barrier to enter the brain tissue. Once in the brain, THC interacts with cannabinoid receptors to produce its effects. THC interacts with cannabinoid receptors in the brain, initiating a cascade of neurological effects. Cannabinoid receptors are part of the body's endocannabinoid system, which regulates various physiological processes. The binding of THC to cannabinoid receptors can alter neurotransmitter release. CB1 receptors are primarily found in the brain and central nervous system, influencing mood, memory, and motor control. CB2 receptors are mainly located in the immune system, playing a role in inflammation and immune response. The interaction between THC and cannabinoid receptors is a complex process with varied effects depending on receptor location and individual physiology. The endocannabinoid system plays a crucial role in regulating various physiological processes. This system significantly impacts mood regulation by modulating neurotransmitter release. Endocannabinoids influence memory processes through synaptic plasticity modulation. The endocannabinoid system modulates pain perception by interacting with pain pathways. Appetite regulation is another key function of the endocannabinoid system, influencing hunger and satiety signals. Through these diverse functions, the endocannabinoid system maintains internal balance and homeostasis. THC activates cannabinoid receptors in the brain. Activation of cannabinoid receptors triggers the release of dopamine. Dopamine release results in feelings of euphoria and relaxation. Dopamine is the brain's feel-good chemical. THC alters the brain's perception of time by affecting neural pathways in the hippocampus and cerebral cortex. The impact of THC on memory involves disrupting short-term memory consolidation and retrieval processes. THC affects focus by influencing dopamine release and disrupting the prefrontal cortex's executive functions. Altered perceptions result from THC's modulation of sensory processing in the brain. Enhanced sensory experiences are linked to THC's influence on neurotransmitter systems and neural connectivity. Marijuana can induce relaxation by interacting with the body's endocannabinoid system, which regulates mood and stress. THC, a key component of marijuana, binds to cannabinoid receptors, which can reduce anxiety and promote a sense of calm. Marijuana may alleviate stress by modulating the release of neurotransmitters associated with stress responses. Individual responses to marijuana vary. Therefore, It's essential to use it responsibly and be mindful of dosage and potential side effects. Medical cannabis is utilized for the relief of chronic pain conditions. Cannabis-based treatments can alleviate the intensity and frequency of migraine headaches. Medical cannabis helps manage the side effects of chemotherapy, such as nausea and loss of appetite. Cannabinoids in medical cannabis interact with the body's endocannabinoid system to modulate pain signals. The anti-inflammatory properties of medical cannabis contribute to pain reduction. Different formulations and delivery methods of medical cannabis allow for tailored pain management strategies. Some artists use marijuana to explore alternative perspectives and enhance creative thinking. Marijuana may act as a catalyst for divergent thinking, enabling new connections and ideas. Musicians sometimes employ marijuana to deepen their sensory experiences and emotional expression in music. Writers might use marijuana to overcome writer's block and unlock new narrative possibilities. The effects of marijuana on creativity vary widely among individuals and artistic disciplines. Certain marijuana strains contain compounds that interact with the body's endocannabinoid system, potentially promoting relaxation. Specific cannabinoids can reduce anxiety and promote a sense of calm, which may help individuals fall asleep more easily. Some marijuana strains may alleviate pain, a common cause of insomnia, thereby indirectly improving sleep quality. Individual responses to marijuana strains vary. Consulting a healthcare professional is essential before using marijuana as a sleep aid. Marijuana use can be integrated into social gatherings as a shared activity. Shared experiences involving marijuana can foster bonding and a sense of community. In some cultures, marijuana use is part of traditional rituals and ceremonies. The act of sharing and partaking together can strengthen social bonds. Research indicates cannabis can reduce the frequency and severity of seizures in some epilepsy patients. Cannabis-derived compounds interact with the brain's endocannabinoid system, potentially stabilizing neuronal activity. Controlled studies are crucial to determine optimal dosages and specific cannabis formulations for seizure management. The efficacy of cannabis in seizure reduction varies among individuals and epilepsy types. Further research is needed to fully understand the long-term effects and potential risks of cannabis use in epilepsy treatment. Cannabis use can lead to a reduction in chronic pain levels. Cannabinoids interact with the body's endocannabinoid system to modulate pain signals. Studies indicate that cannabis may alleviate neuropathic pain, inflammatory pain, and musculoskeletal pain. Cannabis may offer an alternative to traditional pain medications, potentially reducing reliance on opioids. Individual responses to cannabis for pain relief can vary, necessitating personalized treatment approaches. Cannabis has shown potential in alleviating anxiety symptoms for some patients. Specific compounds in cannabis may interact with the endocannabinoid system to regulate mood and stress responses. Cannabis may assist in managing PTSD symptoms such as intrusive thoughts and hyperarousal. Careful dosage and strain selection are crucial for achieving therapeutic benefits and minimizing potential adverse effects. Cannabis can stimulate appetite, offering potential benefits for individuals experiencing appetite loss. Patients with illnesses such as cancer or HIV often experience a significant decrease in appetite. Cannabinoids in cannabis interact with the endocannabinoid system, influencing appetite regulation. This interaction can lead to an increased sense of hunger and a greater desire to eat. Appetite stimulation can improve nutritional intake and overall well-being for affected individuals. Improved appetite can contribute to weight maintenance and enhanced quality of life. Ongoing studies explore the potential anti-inflammatory effects of cannabis. Research also investigates the neuroprotective properties of cannabis. Cannabis is being studied for its potential in treating Alzheimer's disease. Studies are also examining the effects of cannabis on multiple sclerosis. Marijuana use can impair focus by disrupting normal brain functions. Short-term memory is affected as marijuana interferes with memory consolidation processes. THC, a key component in marijuana, binds to receptors in the brain, altering neuronal activity. This interference can lead to difficulties in learning and retaining new information. Heavy marijuana use can lead to a noticeable decrease in an individual's overall motivation. This reduction in motivation is often characterized by decreased engagement in goal-oriented activities. The neurological effects of marijuana can alter dopamine pathways, impacting the brain's reward system. This alteration can lead to a diminished desire to pursue previously enjoyable or necessary tasks. Consequently, individuals may experience reduced productivity and a general sense of apathy. High THC strains can induce anxiety in some individuals. Anxiety manifests as excessive worry and unease. Paranoia, characterized by unwarranted suspicion, can also occur. These adverse effects are more likely in individuals predisposed to anxiety disorders. Dosage and individual sensitivity play a significant role in determining the likelihood of these reactions. Understanding these potential risks is crucial for responsible consumption. Approximately 10% of cannabis users may develop cannabis use disorder. Cannabis use disorder is characterized by compulsive cannabis seeking and use, despite negative consequences. Genetic predisposition, environmental factors, and early age of first use can increase the risk of developing cannabis use disorder. Symptoms of cannabis use disorder include tolerance, withdrawal, and continued use despite adverse effects. Treatment for cannabis use disorder may involve behavioral therapies, support groups, and medication. Early intervention and prevention programs are crucial in reducing the incidence of cannabis use disorder. Frequent marijuana use during adolescence can impair brain development. Cannabinoids in marijuana can disrupt the normal maturation of brain regions crucial for cognitive functions. Impaired brain development can lead to deficits in learning, memory, and attention in young adults. Long-term marijuana use may result in irreversible changes to brain structure and function. Historically, cannabis was a symbol of counterculture, often associated with rebellion and nonconformity. The perception of cannabis has evolved, transitioning from a stigmatized substance to a recognized medicinal treatment. Legalization has spurred the growth of a significant cannabis industry, impacting economies and creating new markets. This shift reflects changing societal attitudes and increasing acceptance of cannabis in various forms. Marijuana possesses a dual nature, presenting both potential benefits and inherent risks. Potential benefits include medicinal applications and therapeutic effects for certain conditions. Risks encompass potential for addiction, adverse health effects, and cognitive impairment. Responsible use is crucial to mitigate risks and maximize potential benefits. Informed decision-making is essential for individuals considering marijuana use. Further research is needed to fully understand the long-term effects of marijuana use.